Good afternoon, everybody. It's LaTanya Wright with KDADS. We'll give a few more seconds. It's straight up 12 o'clock for other individuals to get out of the lobby into the meeting. And we will get started. Good afternoon. We will go ahead and get started. I am LaTanya Wright with KDADS. Thank you for joining us today. And then this is the January 2023 HCBS Update Stakeholder Call that we are kicking off for the month of January. Okay, so if you are here to hear about the final settings rule or general HCBS information, you are in the right place. We thank you and welcome you. If you're in Kansas, it's a very wet and cold in Northeast Kansas, and I hear other parts of the state as I have been in meetings this morning. So again, thank you. Hopefully you're staying warm. For those of you that are maybe unfamiliar with me, I am the HCBS Training Specialist is my title now. So I wear a lot of different hats, but one of them is working on the final rule and the implementation of final rule with a lot of stakeholders and our team up here at KDADS, okay? And then with me today, helping to give updates on final rule and general HCBS updates is Seth Kilber. And I will let Seth introduce himself for those that may be unfamiliar with him.
Good afternoon, everyone. Thanks for joining us today. As LaTanya said, I am the Program and Policy Oversight Director for the Long-Term Services and Supports Commission here at KDADS. Just wanted to provide a brief general update. Some of you may be aware, but we received word last week that the public health emergency has been extended. There was not a date on that. However, past PHEs have run for about 90 days. So, if we're operating under that assumption, we're looking at about mid-April would be when the PHE would be set to expire. And as a lot of you know, our Appendix K measures in the HCBS waivers will run for 6 months after the expiration of the public health emergency. So that would put us about mid-October for Appendix K to expire, assuming it does expire in April. That said, we're also working on getting ready to submit our waiver amendments to CMS here the next few weeks that have a lot of those Appendix K measures put into the waiver. So hopefully we'll have those approved by mid-October. That's our goal anyway, so that when those measures are set to expire, we'll already have those in the waivers. Another update, wanted to just remind everybody that the workforce incentive bonus deadline is March 31st in a couple months. So if you do have any questions related to that, please direct those to kdads.workforce@ks.gov, and I will put that in the chat as well. Last update to provide our statewide transition plan for final rule. The public comment period ended, so we have officially submitted our STP to CMS as of last week, and we'll be just waiting for any updates that they can provide us with that once they've got a chance to review. I'll pass it back on over to LaTanya unless anyone's got questions related to anything I've just shared.
And we'll open it up for questions, everybody, at the end so we can get through the agenda. So please, as LaTanya always reminds you, make sure you're putting your questions in chat. We have staff helping us out, Ian Kinsey helping us out to watch that chat. So before you forget it, make sure you get it in chat or you write it down if you're on the phone calling in. So when we open it up for questions to everybody. You can get those answers, and I'm pretty sure other people, as we always know, have that question too, or it triggers off other questions for the group, okay? And then adding on to those general updates that we always kick off with, I want everybody to know that KDADS will be facilitating these monthly update meetings. Excuse me, update meetings. So again, as Seth gave out, we will put our contact information in the chat box. I'm pretty sure a lot of you already know how to get a hold of Latanya due to final rule or through the CDDOs or the MCOs or our aging partners, as I like to say, okay? And then due to the, for those that would, these were called the final rule stakeholder calls, but again, we're calling them the HCBS update calls kicking off this month. And so we used to have one in the evening at 5:30 due to decreased attendance of that. As of now, we just have this 12 o'clock call scheduled, and then we will be getting the meeting notes and then, of course, the questions and answers, and we will be getting that information out on the KDAD's website within 48 hours after this meeting ends, and then getting that out there for individuals that are missing the meetings or not able to attend, okay? Or for the have, if you miss something, you'll be able to go out there and within 48 hours and follow up and see what topics we talked about. So wanted to get that out there for you all, okay? And with that, I'll move on into remediation updates for the final rule. So a big part of this after the general updates is we're going to cover the final rule because that is what is very, very important for the state. As Seth went over, our state transition plan is final version of that has gotten kicked off. So we're waiting on a response back from CMS on that. And then, of course, the remediation. So as you all know, I hope you are signed up for community connections. Stress, stress, stress. Please spread the word because I am still getting emails. Community connections as of December the 31st is closed down. A lot of the final rule has been brought back in-house to KDADS. And so the HCBS compliance portal is where is the pathway to final rule compliance to the state of Kansas. Community connections for the public entry and usage is no more, okay? So you cannot go in there and access any old information. That's why we were working very hard over the holiday to do that big data migration to bring all that community connections information over to the HCBS compliance portal. So, or if you are an existing provider, that is where all your information is. Right now, we're in a big, big, big data cleanup. So spreading the word again, please, if you're a CDDO, an MCO, some of our aging partners on here, a provider, talking to your peers, your staff, your colleagues to let them know, hey, are we on it? Have we gone in? Have we reached out to Latanya and the final rule team to make sure we have access to our account? Please email me. Getting into that account, making sure all your settings have came over, cleaning when you first sign in to the HCBS compliance portal. If you haven't already been in there, putting in new settings, or if some of your settings have came over from the community connections portal, there will be some requirements. When you get in there, you're going to see some red flags of additional information that we need that was not collected in the community connections portal, but we found out after the fact this is some setting tracking information that we do need. So you will have to fill out and complete that basic, like maybe it's contact information, NPI number, city in Kansas, because a lot of times we're getting a lot of settings that might have the same name or providers that have the same name. So we want to make sure that's one way we can figure out is that setting with the correct provider if we're looking at those cities across Kansas, okay? So that is one thing. You cannot move forward in the portal until you do all that basic information for the settings, okay? So that's very, very important to get in there. Again, we are in a big, big data cleanup. Again, making sure your settings came over. And if I'm reaching out to Latanya, I will put my email in the chat for those of you that might not have or know how to get in contact with me. And a reminder on that, please email, as we are still, the state of Kansas is in that hybrid working. Sometimes I'm in the office. A lot of times, we're in the middle of a lot of sickness, the flu, colds, COVID. Latanya has a low immune system, so she's not really in the office, okay? So please, email is the best way to get a hold of me. And I'm pretty sure a lot of other state staff, if you leave me a voice message, it might be a while before I get back to you, okay? Usually when I go into the office, I have like 30 to 40 voice messages I have to get to. So I don't want you, again, being out there, Latanya, I'm trying to contact somebody. When if you shoot me an email, a lot of you know I will get back to you within 24 hours, okay? So big, big reminder, please, email is the best way to get a hold of state staff, okay? And then if you have a setting, I'm getting a lot of these emails. Some of you are already on it. Thank you for being on top of your settings and your final rule compliance statuses. If you have settings, a lot of things have happened since we kicked this off in 2019, okay? If you have a setting that has relocated, it has moved, or that setting is no longer open, it has closed, or you are wanting to close that setting, right now that feature is not available for you as a provider to go in and make those changes, okay? So you got to email me, reach out to me, and we're going to have our IT department go through there and take out those settings that need to be removed from your list, okay? So a lot of times we have a couple that maybe that's what's holding them up from meeting final rule compliance, or they need to update things. They've done a new assessment, final rule assessment for that setting because it's relocated, and they're like, Latanya, we don't need that old setting in there, okay? So again, when I put my email in the chat, please reach out to me and I will get that on the list for our IT department, okay? And then after, I want to do a heads up on that little caution there. After I have the IT department remove that setting, if you're requesting, okay, if you come back, sometimes it happened, maybe somebody moved out, or maybe you closed that setting because you didn't have enough staff. And then 3-4 months down the road, you're coming back and saying, hey, Latanya, I need to reopen that setting right now. You're going to have to re-enter all that information, okay? So make sure before you send me that email and say, hey, Latanya, remove that setting, that you're sure or you understand, you and your staff, that you're going to have to re-enter all that information over again. And if your setting has moved, then you're not able to update all that information because, again, yes, that setting may have been found compliant at the old location, the old address, but every time a setting move, a lot of it is our IDD day services. We notice, hey, when you move to a new location, a new physical location, we have to do a heightened scrutiny assessment. And again, that heightened scrutiny is, are you adjacent to an institution like a hospital or nursing home or something? Are you on the same grounds? Are you attached to? We have to do that heightened scrutiny assessment. So when you move, we're saying, hey, you might be, we do the desk review, you're compliant on the general final rule stuff, but we still have to do and check for that heightened scrutiny, okay? So that's very important to remember with that, okay? And then remediation status for our numbers that we like to provide. Again, we're doing this big data cleanup. So those numbers are not ready. I was working very hard to have those numbers ready. But again, I'm working with providers to get things updated, get settings removed, making sure they're working on their new settings. So I do not have that data right now. We're working very hard to clean up this data so we can get that released, because we need to get that out here soon, because we do have new providers, new settings, and then we need to get out there because, again, March 17th is around the corner, and getting that updated provider status information out there. So I'm working very, very hard, hoping to have it within the next week. And again, we will get that out to the public. Make sure, again, you're on our mailing list so we can get that sent out to you, and it will be posted to our final rule website out on KDADS, okay? So we are working to get that out there. Again, we put it out there by provider status. So is this provider compliant? Are they waiting on heightened scrutiny only? We do not publish those individual locations because sometimes those can be private homes. And of course, we want to make sure the privacy and confidentiality of those waiver participants are protected. So that is one thing. When that list comes out, it will be by provider status, okay? And with that, I want to make sure, please, again, all of our stakeholders, pass the word, pass the word. Do not wait until the last minute to complete your final rule assessments, or you've completed your final rule assessment. You've got a response back from KDAS, because we are working very hard. Our team, we're using all of, volunteers from other departments, our licensing department, our PIC department. We're all back behind the scenes working as hard as possible. When you send those assessments in, we're getting them done so we can get your response back as soon as possible, okay? You get that assessment back. It's telling you you're non-compliant. Hey, start working on that remediation. If you don't understand, again, reach out to us, reach out to Latanya. We can help you do that one-on-one assistance, because we want to get that setting compliant so you don't have to go through the transition process, and we can get you compliant before that March 17th deadline, okay? Please, remediation takes time. It's about a lot of policy updates, understanding that type of language you need to put in that policy before we can make it compliant. That takes time, okay? We know you guys are out there working, providing services, and then you got to whittle away a little time to work on your policy updates or manual updates or whatever you're sitting in as evidence for remediation to meet final rule compliance. Okay, that takes a lot of time, okay, for some people. So we want to make sure you have time because we don't have 2 years like we did to do remediation, okay? We have basically 2 months, okay? So I really want to stress that. And please, 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 if you see somebody's not in the room, you have I know our CDDOs have been reaching out. Hey, LaTanya, what information can we share? That is something that you can share. Again, thank you all again for our case managers, our licensing, our CDDOs, our MCOs. I have been getting a lot of contacts. Hey, LaTanya, do we need to be assessed? Again, if you don't know, you don't understand, send them to me and I can get them where they need to be, okay? We really appreciate all of that and us working together to meet final rule compliance in the state of Kansas to continue the services, okay? And with that, that is the remediation update for now. And I will turn it back over. Caitlin England is not with us today, so Seth is going to fill in and do the heightened scrutiny update for Caitlin.
Yeah, so heightened scrutiny. The team is going to be reaching out to settings that have been flagged for heightened scrutiny to schedule assessments. So just please make sure you're getting in the portal, checking for communications there. If your setting was flagged for heightened scrutiny and community connections, you will see in the new system that whichever question you were flagged for, it'll be marked as non-compliant. So just make sure you're looking at that heightened scrutiny status. Just remember that if your status is pending CMS review, then there's nothing you really need to do at this time. However, on that note, we were invited to submit a corrective action plan to CMS related to these heightened scrutiny settings. And that's just a vehicle because I think CMS realized that they're not going to be able to review all of the state's heightened scrutiny settings prior to March 17th, the deadline there. So we've got a corrective action plan with CMS related to these heightened scrutiny settings that we're waiting for them to review us on. So it's a little bit convoluted there, but the takeaway is that if you're waiting on CMS review, just stand pat. We will share information as soon as we have it, and you're not currently at risk. You can still continue to operate out of those settings for the time being. Let's see. Related to that, CMS is going to be visiting Kansas to do some on-site visits in March. We don't have the exact dates yet, but they're planning to visit a variety of settings and conducting walkthroughs and interviews to evaluate how well the state has done in evaluating settings. So they've asked if we've got any settings that we'd like to provide them to visit. So if you are feeling bold and want to volunteer your setting, please reach out to Caitlin or I via email, and we will get you on the list. It's not necessarily a guarantee that if you volunteer, you will be visited, because again, there's just a bunch of logistics that we'll have to work out with them in the meantime. However, we're very eager for this visit because we'd like to see how well we've done when it comes to assessing these settings as well. Hopefully we're on the right track, but they've conducted a number of site visits already with states and have identified a handful of themes through these visits, things like PCSPs not being followed or not current in the setting that the person is residing or receiving services in, not known by the staff, not identifying what's important to the person, or not reflecting the person's preferences and how the setting relates to that person being served in the community. Staff not necessarily knowing what the final rule is or not understanding the distinction between home and community-based settings and institutional settings. Often, they reported that staff thought institutional settings are really just for those who need more advanced level of support. And as a lot of us know, that that's not necessarily the case. HCBS is really about the integration component, and that's really why Final Rule is trying to get us more into that integrative type service delivery model. Other themes include work and community engagement, not being fully integrated and not individualized for meaningful engagement, uh, possible undue restrictions related to visitors and needing to request permission or time limits on how long somebody could come stay, amount of visits, things like that that aren't that didn't go through the process of proper restrictions. Lease and residency agreements need to be similar to those that anyone else might typically sign. And so sometimes there's language in there that wouldn't be in a lease that you or I might sign. So they're looking at those. And then obviously, we're going to hammer this pretty hard, but any modifications to the rule must include specific requirements written into the PCSP. And there's kind of a list that has to be run through before you can make some of these modifications to the rule. Um, so that's kind of just a real brief overview of some of the things that CMS has pointed out that they've come across in some of these site visits. So that's been helpful to kind of identify, and we wanted to pass that along. So you all who provide the services can maybe be thinking of that and how you might mitigate some of those as well. So kind of back to community connections and heightened scrutiny. If you have a setting that was in community connections that is moved to a new address, you will need to submit a new assessment for that address so that the geographical location could be assessed for heightened scrutiny. Because one of the categories is the distance to a potential institutional setting. So if you physically moved addresses, that setting will need to be receive a new assessment. So I think that's all I have for heightened scrutiny. Unless I'm missing something, Latanya, you'll fill me in. But I think we can move on.
Thank you for those updates, if I can talk, I tell you, it's this cold and this rain, everybody. But yeah, but really want to make sure everybody really heard when Seth was talking about for our heightened scrutiny settings. I know a lot of you are very anxious. You're reaching out. Hey, this is the only thing we're waiting on. What's happening? March 17th is coming. So as Seth said, we talked to CMS. CMS said, hey, go in and send in a corrective action plan for your heightened scrutiny, because we were able to let them know, hey, we don't know what you guys are going to come back and say because you haven't gave us the final determination. So for our heightened scrutiny settings out there, okay, heightened scrutiny settings only. Okay, stress that you guys are going to be okay. We've asked for that cap to say, hey, we're going to need more time for these heightened scrutiny settings to make sure if you come out here, CMS, or you pulls and push something back to the state and say, hey, Kansas, you didn't do this right, Kansas. You need to do some adjustments to your heightened scrutiny process. Then that will give us time to go back and work with those heightened scrutiny settings to make those needed corrections. As Seth talked about, we've been meeting with them. If any of you have been able to attend the webinars, CMS is going out there. They're not liking what they see overall across the nation. And they're saying, no, you guys are saying that you're compliant as a state, or these settings are compliant, and we disagree with you. Hey, let's go back. Let's pull back. This really isn't the intent of final rule. Okay, so that's going to give us some more time. And stress. I asked the question. We have a meeting with them next week. I'll ask again. So, okay, the other settings outside of heightened scrutiny CMS, will there be an extension past March 17th? And as of now, they say no. So if you have things, unless we can prove that it's not being able to be implemented because of the public health emergency, they like, you guys better get it together. Those policies, those regulations, those other things that are not preventing individuals from following final rule, providers from being final rule compliant. No, we are not extending any deadlines for that, okay? Just right now is the heightened scrutiny stuff that we're trying to finagle and get some more time for y'all, okay? So if you are a heightened scrutiny, your heightened scrutiny settings out there are okay as of now, from our understanding from CMS, okay? So I know a lot of you, that's all that's holding you up. Maybe you're in assisted living, or maybe you just have one setting that fell into that heightened scrutiny category and you're waiting for that final determination from CMS. We cannot make you compliant until CMS says it's okay. They agree that what we've done for heightened scrutiny from the state of Kansas, okay? So making sure that's clear, okay? And moving on, we'll do the trainings and communications, okay? So again, as I talked about early on, we are using all of our resources again to process these assessments and get you guys compliant again before this March 17th, 2020 deadline that CMS has put on us, okay? So that's where all our resources are going. So that's what no training before March 17th. Okay, because again, Latanya wants to make sure we're putting all those resources on that. But after March 17th, we'll see where we're at as a state. What do we need to do? Planning for that, and then really getting out late spring, early summer. Because after March 17th, we will be going into ongoing monitoring. So wanting to get some information out there for you all. What to expect from that. What does that look like? Once your setting becomes final rule compliant, what does it look like to go into ongoing monitoring and who's all going to be involved in that? We are meeting with other state level entities like licensing, KDHE, discussing all of this ongoing monitoring to make sure we're all consistent across the state and other departments, to make sure we're all doing the same thing with you all and you all understand and know who to go to when you have questions or need clarifications, okay? And for those of you providers or staff that are working in the HCBS compliance portal on those assessments, make sure when you go into and you sign into your account that there are tip sheets in that training video when we did training on the portal back in August, okay? So that information is in the portal there for your usage, okay? So those are very helpful, how to navigate through the system, what to do, and how to complete that assessment. And then I also stressed one thing we did as you're going through your questions, there's 40 assessment questions. Make sure you pay attention to that question and those drop down menus because it gives the suggestions on how to respond back to that question. Okay, if you look at that, you follow that guidance, those that do that, I mean, they are ready. They can go through remediation in a couple days, okay? When they set aside time and they really focus and it's like, hey, I want to get this off my desk, leave me alone, Kate. I love it when you guys tell me that, Latanya, help me. What do I need to do so I can be done and I can move on and provide these needed services out there? Okay. I have no problems doing that, doing a one-on-one with you to make sure you understand. Because again, I want you to do it right the first time so we don't have to go through that back and forth for remediation. Okay. Again, always reach out to us. We're here to help you. Okay. And then along with that, heightened scrutiny. So again, if you're a new setting out there, you're going through that heightened scrutiny. So for questions 1 and 2, you will need photos. Those photos, we have to see those views, those bird eye views as they call, because we also double check that. We have to see where your setting is located. Is it attached to a building? What's those big buildings next door, behind you? We have to look for that to be able to verify. If you say, no, we're not attached to a hospital, we're not on the grounds of an institution adjacent, which is like across the street, next door, we have to be able to visually see that and check that address that you give us for that residential or day service location. Okay, we have to check that. But for all the other 38 questions, you have to have policies and procedures. Okay, you can only use photos to meet compliance for question 1 and 2. All the rest of them you will need policies. And with those policies, a lot of you do good, you sit in your policies, we have to have agency branding. So we know this is the agency that it goes to. So your logo, your name of your agency, what is the policy implementation date? Is it something you're already using? Is it a current policy you made up? Or a lot of you have, a lot of hoops and boards committees you have to go through to get your policies updated. So you're saying, hey, this is what we're going to do, is going through the process. As soon as it gets done with, whoever it needs to go to, we're going to implement this at this future date. We have to know those things because again, when we come out to do ongoing monitoring, that's what we're going to hold you accountable for. We are going to pull that and say, okay, you said as an agency, this is how you were going to meet final rule compliance. And This is what we're going to hold you accountable for. So that is so important. We get a lot of their good policies, but it's like, well, who does this go to? Okay. This is just something written down on a Word document. We don't know if this is your policy, if this is the next door neighbor's policy for their agency. We need to know those things. Okay. Those are very important. And then again, as I talked about, really stressing because I get this question a lot this summer. I'm hoping we can get out. I'm looking forward. I know I will be out there on the road coming out. Really want to start that ongoing monitoring to come out and do those face-to-face, those one-to-ones assistance, remediation assistance, and attestation, ongoing monitoring, getting out, talking to our providers and our waiver participants, and seeing how we can continue to be final rule compliant in the state of Kansas. Okay. And then one of the things I really want to do with these meetings, after we do general updates, I will be looking to use this time and other time as needed to do, as I call them, guidance sessions and trainings, as we need. We see concerns or we have questions, the same questions coming from you all. Really use some of this time later in the years to provide that information, that guidance, and really getting on top of things to make sure, again, I see Final Rule has brought out a lot of areas where we need to update training policies. And again, after we get past March 17th, everybody, Latanya will be out there and we'll be working very hard as a state to make sure we have training and those resources out there for you all. Okay. So those are the updates for communication training and resources, which is Latanya. And so at this time, we will see what's in chat and then respond to what we have in chat, and then we'll open it up to those on the phone and for those that have came in later that may have some questions. Okay. So Ian, how are we looking with questions in chat? I've seen a lot of stuff pop up while
We,
me
we,
and Seth
we,
were talking.
we've got a few, but some of them have been answered. Can you hear me?
Yes, I can.
Okay. Um, SSDI from Garden City asked for Seth to please provide his title again, and Seth was nice enough to do that. Uh, Seth's title is LTSS Program Policy and Oversight Director. And then Jeanette Livingston asked, "Is there a deadline for new settings to be determined compliant to avoid notification to process uh to I'm sorry for persons served so they will not have to move." And I believe Latanya, you covered that, but if you'd like to go ahead and answer that question again.
So right now, yes, as of January the 1st, we're going as it is. There is no overall deadline because, March 17th is the federal deadline. So we can just go as fast as possible. Right now, we have no state policies or regulations in place to stop new settings from opening, unfortunately. So that is the risk, everybody. If you have a new setting out there or providers are coming in, they're opening up new settings, we cannot stop that at this time. But there is a risk if that setting is not final rule compliant, then after March 17th, CMS has let us know HCBS funds cannot be utilized on that setting until it comes into final rule compliance. So that is the caution of opening up new settings and not being able to come final rule compliant. So if you open up a setting on March 15th, I'm pretty sure you're not going to be able to be final rule compliant by March 17th. Okay. So again, like I said, we're working as hard as we can. I know we've pretty much got most of them that have came in since July done, and we are still daily getting new settings that are open. So again, we look every day. We have a great team up here. There's 6 of us. They come in, we get them processed. Okay. So again, Jeanette, I am working to get those lists out there. And of course, a CDO, some of you are very good. You will send me your list of affiliates and say, hey, Latanya, hey, are my affiliates compliant or not? I have no problem with making time to get you that information because you guys are all really great to get us that, help us with that outreach to say, hey, you need to reach out. You need to be getting into contact with Latanya and the HCBS Final Rule Compliance team. Okay. So right now, as of January the 1st, hey, it's just go as they come in, and that will be the process. Hey, new setting out there, get it in, or you're a new provider, get in contact with us so we can process it as soon as possible. And again, after March 17th, we cannot provide HCBS funding for those settings. So that's the risk, and the provider saying, hey, do you have other funding to cover those costs until you're HCBS compliant, okay? Final rule compliant. Next one.
Is from, I believe, Mandy Endicott. She asked, hold on just a second. She asked, how do you delete settings?
As of now, as providers, you cannot delete settings because again, we're looking at the data, making sure everything's okay. So that is for, send me an email. I put my email in the chat. So if you have a setting, Mandy, and you want that setting removed, send it to me and I will have IT to remove that setting. But again, I gave the caution, once we get that setting deleted, if it reopens, because they will close settings or somebody moves and then, you know, a couple months later, maybe that setting reopens, you will have to put all that information back in, okay? So reach out to me and I can get that setting removed for you through IT. And then once that is a feature that we are working on behind the scenes. So eventually, after again, we get all this data cleaned up, you all have let me know, hey, we're good on our setting information, LaTanya. Then we will get it opened up so that the providers will be able to go and remove settings, okay? Next question.
Steve asked, the definition of shared living in the portal states it is defined as one person. Would it still be defined as such if there are two persons served in the same shared living setting?
Thank you for asking that question, because yes, I have been getting that question, and that's one of the training areas I am working on, is that shared living. So when we started out and we did this, that is one thing that's going to get updated too. It was when we were interviewing and reaching out, it was we were told that it was one. And as you all know, shared living is an area that is being worked on for the state of Kansas for those regulations, those definitions, and how to run that area of HCBS. So yes, if you are in there, shared living is 1 to 2 people, okay? So ignore the one. We're working to get that updated. So that is 1 to 2 people in that setting, okay? You are fine to put that in there. Basically, we need to know that it is a shared living setting under home and community-based services, okay? Thank you for that question.
And I believe that I missed one, and I apologize. It was about the corrective action plan, but we've already said that we are going through a corrective action plan. And then Monica said that there are 14 states that uh, didn't have one. There are only 14 that didn't. So there's that. And then somebody asked, is the cap viewable?
Yeah, so
Uh,
we did submit the cap on November 30th, I believe it was, and I don't believe it made it on to our website. I'll ensure that it gets up on our website under the final rule page. So check back in a day or two, but I believe it is available on the CMS website, although I can't provide you with the link right now. I'd have to look that up to see where they posted, and if they posted it yet. But they did say that they would post it on their website as well. So we'll make sure we get it up on ours, in addition to CMS.
and then Latanya provided her email address. Thank you, Latanya. And then Debbie asked, when did CMS say that they were going to have the visits to Kansas?
They are coming in March. So we are like, hey, wait a minute. March 17th is the federal deadline. Why are you guys coming in March? They are coming in March, everybody. Yes, we have a meeting with them tomorrow.
March 13th through the 17th, it
Yeah.
looks like the dates are. So
Mm-hmm.
the positive about the corrective action plan that we submitted is that you know, if there are identified concerns related to final rule compliance in the state of Kansas, we would have the opportunity to amend our corrective action plan to hopefully encompass some of those. But we are restricted to PHE and pandemic related delays. So we'd have to be able to tie it back to the pandemic and the public health emergency if we wanted to include that in our corrective action plan, which is fairly vague and broad, because we all know there have been some, you know, you could wordsmith it however you want. But everybody's dealt with, I know, staffing issues and just all sorts of things related to the pandemic. So I think we'd be okay there.
Okay, Sheila asked, how do we know the difference between issues that we need to remediate and which that are waiting on CMS decisions? Are they marked differently?
Yes and no. We know. So, okay, everybody, heightened scrutiny is the only thing that we are waiting for CMS. So questions 1, 2, and 3 are the heightened scrutiny questions. Okay, that's where it's asking if you're attached to a building on the grounds of, adjacent to, and the other, what is the other one? If you are, I think number 3 is if you are in a gated community. Those are the heightened scrutiny questions that triggers heightened scrutiny depending on how you ask, and then when we verify the response to those questions. So if you go into the portal and you see your question 1, 2, 3, all 3 of them, or maybe one of those 3 is not compliant, that's how you know you're being held up by heightened scrutiny. If all the other 37 questions are compliant, okay? So after question 3, those other 37 questions is your general remediation if it's not compliant. So you can work on all of that and we will work with you because we got to get those done. And a lot of that will help answer some of those questions for questions 1, 2, and 3. Again, questions 1, 2, and 3 of the assessment are your heightened scrutiny questions. And all the rest of them is your general final rule compliance. Okay. I hope that makes sense, Sheila.
Chris May asked, after March 17th, when a new setting opens, how soon after it opens do new settings have to be assessed to be in compliance?
After March 17th, when a new setting opens, how soon after opening do settings have to be assessed and be in compliance? Well, Chris and everybody, until that setting meets compliance, and again, it depends on how many questions need remediated, how quickly the provider is working on that remediation with the provider. But after March 17th, as of now, that setting cannot receive HCBS funding until that final rule compliance is met. Okay.
All right. Thank you. Sheila again asked another question. She asked, how will this deadline work when clients move frequently? Providers just wouldn't be able to be paid until the new setting can be determined compliant.
That is true. Yes, that setting has to be reviewed for heightened scrutiny. Yes. So maybe that at the provider level with your policies and procedures, you're compliant, but every time there is a new location, a new address, a new setting, we have to review for heightened scrutiny. We have to do a heightened scrutiny assessment. That's why we were saying earlier, you just can't go in and say, oh, this is still the day service. This is still the same person that's being served. We just want to update the address. And we can't do that. CMS has said, nope, you have to do that heightened scrutiny assessment each and every time for that new location.
And we'll be working with our partners over in licensing and at the MCOs and CDDOs to kind of, as we move into this ongoing monitoring phase, because we know final rule is not a one and done thing, because it's a constantly target that is moving. So in the event that there is a setting that is, kind of squeaks through the cracks, so to speak, and we become aware of it, uh, at that point, we would be moving into transition activities, given a certain amount of time for that setting to come into compliance. Um, Otherwise, the individuals would need to transition to a compliant setting. But we're working with CMS on kind of smoothing out those details and seeing how that actually gets operationalized, and we'll share more information as we have it, how that actually kind of works from a rubber meets the road standpoint.
Thank you. John Gradell asked, does there need to be an explanation of day rest provider in the limited license as opposed to the full license?
If I'm understanding correctly, and if not, please clarify. Are you asking, is there a difference between a full license and a limited license when it comes to final rule? Day and residential services, because if you are receiving home and community-based services, it does not matter how many people you serve. You still have to be assessed, if I'm understanding the question correctly. So I know a lot of our limited license providers are saying, well, hey, Latanya, I only have one person. I only have two people. I'm not that big provider with 50, 100 to people. No, CMS said, nope, they receive these fundings. This is a setting. A day of residential services. These are public Medicaid dollars. They need to be assessed to make sure these services are being rendered as required by the settings final rule. And if that's not what you were asking, please let us know, John.
Yeah, John, to expand on that, limited license may have different licensing requirements. However, from a final rule perspective, if it's considered a provider owned and or controlled setting, then it there's no distinction made there.
Thank you. John asked another question. He asked, why were providers who were credentialed in 2022 not required to meet a final rule prior to starting services or being approved by KDADS? Will this be changed moving forward?
My apologies, but if you've been around a long time, you know things got put on the shelf in the state of Kansas with final rule. And the reason for that is because the regulations and the policies were not in place to stop that, as I had talked about. So services were just going on, and as you know, the things really got regrouped back in 2019 and said, hey, we got to get this done. The clock is ticking, because as you know, if you've been around in this process, you know, we got a 1-year extension. We were supposed to meet final rule compliance last March. And because of COVID, a lot of the states went and cried to CMS, and CMS was overwhelmed with they're like, okay, we'll give you 1 more year extension, states, okay, to meet final rule compliance. So again, we are implementing, you guys hear me when I say, hey, the state of Kansas is trying to stay 2 steps ahead of you. We're all learning this and implementing this at the same time. So that's one thing. It's the state. It's a lot of bureaucracy, red tape, hoops to jump through when we change policies and regulations. So, unfortunately, we've had staff changes and staff shortages too. So sometimes things can't stay ahead of what needs to be done. Okay, so we know that's what the if you go back to 2014 when final rule first came out, that was the guidance that was giving to not allow those new credentials until somebody was final rule compliant. That was before Latanya's time. So, the team that was working on final rule before then, I can't answer for them, but we've done the best that we could, John, since this team really took over in 2019 with that. I completely understand your question. And yes, as Seth said, we are working with other state entities, every day working to get those changed. But again, it goes back to regulation updates, policy updates at all different levels to make sure we're all consistent in our final rule implementation. So yes, those things will be getting changed eventually.
Okay. Thank you, Latanya. Sheila said that she hopes that everything can move quicker with compliance being determined with ongoing monitoring and future compliance, and she thanked us for what we're doing. And then Jeanette came back in with another question that says, if a new setting is working toward compliance but isn't compliant by March 17th, will notification go out to person served?
I'll take a couple of these. Sheila, yes, thank you. We agree. We hope it goes quicker too. With this new portal, we're not quite operating as at a well-oiled machine state yet, but we're hopeful that we'll get there. Because we obviously want to reduce the burden and the friction that it takes providers to become compliant, as much as we can, there as well. Jeanette, as far as your question, that's really going to have to be probably a case-by-case basis to start out. And it's really going to depend on how much the provider is engaging with the process. Understand that there are some circumstances and factors outside of their control. But we've got providers, one now, I think, who are in the middle of a transition process with, because they hadn't been engaging with the process at all over the last several years. And now at the 11th hour, they're wanting to come into compliance. So it's really just going to be a case by case basis. But I'd strongly encourage, if you know of any new providers or any new settings that a provider is going to be opening, to just be in communication with us and make sure that they're in the portal, doing everything that they can to come into compliance, because that'll be something that we will be looking at.
And I'll add on to that, Jeanette, I'm trying to get, like I said, we're right now in this data cleanup, I'm reaching out, trying to get providers to come in here to update their stuff so we know what settings need to be eliminated, which do you have new settings in here, and getting that all updated, getting our list from our other entities to compare against our final rule portal to say, okay, who's not on our radar, reaching out ASAP. But again, trying, once I get all this data cleaned up and our team gets all this data cleaned up, then trying to be like, can we get out a weekly update to say, hey, these are the providers that are on our radar. And we ask you all, some of you are so great in saying, hey, we don't see this provider. Some of you providers will be like, hey, we also own this on the other side of the state. We don't see them on the list, LaTanya. We can catch them like that until we get things going up and get our consistent processes going. So as soon as we know, we get that information, we will be getting that information out, and it's just going to be from now on in 2023, it's going to be just a continuing process, okay, until we get all the features built into our portal, where it will be a process again, as we've talked about, that HCBS compliance portal. We're building the features as we work on things, as we see more things, we run across more scenarios, we go to our IT team, which is great, and say, hey, we need you to build this. But again, that HCBS compliance portal is going to be that pathway to compliance, and as we are working to update some KMAP processes and all those things to be able to catch where we can, and licensing processes to catch everybody where we can. So, because we don't want providers opening up new settings or coming in and not knowing about final rule and saying, hey, before you start these services over here, do you know about final rule? So we're working on it, Jeanette. It's a process. It's a lot at the state level.
And as far as the notification piece goes, um, kind of how we're envisioning this right now, we've got it in policy. It's not finalized, but when we can put it out for comment, we certainly will. We're kind of hoping that the provider will be able to provide a notification. KDADS will be providing a notification at some point, and the MCO care coordinators will be providing a notification. So the notification will come at least 3 separate times to the individual, in that non-compliant setting, so that they've got plenty of advance notice of what's going on, and what that means for their services and and where they receive them.
Okay, I see another question popped up.
Yeah, there's one more. There's one more question that popped up from Sheila. If there's a provider owned or managed setting that is determined compliant, and the individual moves from there, and there's an empty, and it is empty for a short time until another individual moves in. Should we just edit the site to indicate the change in the number of HCBS individuals there and leave the site in on the compliance portal?
Yes, you should. So that's a good question and clarification, Sheila. Thank you for that question. So everybody, the final rule compliance is with the setting. So it's that setting. So if you are, yeah, if you own that setting or you're going to reuse that setting, hey, I tell providers all the time, don't close that setting. If you know people are going to be moving in and out of that setting, you own it, or you know you're going to use it again. Yeah, leave it open. So yeah, we're just making sure that that setting is final rule compliant. And then Sheila, as you're saying, you will update the number of individuals served at that setting. That will, when we get it all connected together and it's dinging like, oh, we have 5 people over there, and we're looking in the portals like, yep, they're updated over there. Okay. Did we have anybody on the phone that needed to ask a question? No, we got a lot of questions.
There, there is one more question. Actually, there's a few more questions. I'm trying to take notes and monitor this chat. So, does Monica asked, does licensing share info with the new provider when they license them?
Yeah, we're working with licensing right now on kind of where final rule kind of fits into their process. Um, it'll also be at the KMAT, when it comes to a new provider, um, they won't be able to actually enroll with KMAP until they have been through the HCBS compliance portal. However, that doesn't really solve the issue with new or already existing providers opening up new settings. That's where the ongoing monitoring and settings or providers needed to get in there and attest or make sure that settings are still current or that they've got new ones and make those changes. Um, However, when it comes to licensing, technically, when you open up a new setting, you're supposed to alert licensing, and so then that's where we're going to be trying to work with licensing at the time that the new setting is we become aware of the new setting, so that then that provider knows what they need to be doing for final rule as well, and so licensing can share that information and that they have all the required info.
Few more questions coming in here.
Well, hey, let's hold up on that. Ian, I know some people are on the phone call. I want to make sure everybody's unmuted. Is there anybody that wants to unmute on the phone? I want to give them a chance to ask a question. If you know how to unmute yourself, sometimes what is it, the *6, I think it is. It depends on your phone service, or unmute, however you are muted on your phone. John, did you have a question? I see your hand raised. Okay, well, I just wanted to open it up. Again, you can send follow-up questions to me. Okay. Okay, Ian, we'll go ahead. Yeah, I just wanted to give those on the phone a chance to unmute.
I believe Seth answered the question about licensing just a second ago. Trying to figure out where we're at here. Rachel asked if these meetings are being recorded so that they can access them later.
Yes, they are being recorded, and then we will be talking to the individuals over our webs, like how big they are, because this is a Teams meeting, and I have found out Teams will delete stuff automatically. after a certain period of time. So yeah, we will be working with our KDAD staff on that to be able to find the room, because as you know, these files get really, really big to be able to access later. But like I said, we'll really take the key points, the Q&A, and that will be a document that will put a PDF document we'll have out there to refer back to after we look at the video and take the notes for everybody. Okay.
This is John Gerdell.
Yes, John, go ahead.
So I want to go back to my question I put in the chat because I don't think it was actually answered. I know of a couple of providers in 2022 that got set up and they weren't required to have final rule done prior to starting services.
Because the process wasn't in place for that. We cannot stop you from getting your license to provide HCBS because the regulations and the policies aren't there at the state level to tell licensing not to do that, John. Yeah.
Well, that doesn't really make much sense because they're going to have to do it anyways. Why shouldn't it be two at the same time?
So we understand that. Yeah, it makes sense to us. Like I said, CMS gave the guidance in 2014 that somebody shouldn't be able to get their license for HCBS until they are final rule compliant. But as we said, we're coming in, this team, and we're doing what we can. It makes perfect sense to me. Mm-hmm.
Yeah, John, they'll still be required to meet the March 17th deadline. So if they're not compliant by March 17th, then yeah, we'll have a problem.
Okay. Okay, thank you. Do shit backwards.
That is all that is in the chat at this time.
Okay, we're 1 minute over, so if somebody can stick around and we didn't get to your question, yeah, unmute yourself and we'll get it. If not, we'll wrap up. A lot of information. Is somebody needing to talk? If not, I'm going to mute everybody. All right, I'm not seeing anybody unmute themselves or anything new in the chat, Ian.
You can't hear me.
Who's
It isn't
that?
working.
Okay.
Can you hear me?
Yes, I can now. Who is that? Please let us know your name.
Okay, I'm Jane.
Hi, Jane.
Newcomb.
What's your
And
question?
I have been doing *6 and unmuting for the last 2 minutes.
I'm sorry. Sometimes it works like that.
Yeah. Well, I'm getting very concerned here of listening to what is being said. We have residential clients here, but they all live in their own apartments. We don't have any control over those. Are they supposed to be doing this final rule too?
It depends on what you're billing for.
Because
Are you billing residential
to me,
services?
yes, it sounds to me like you're saying, I have two right now they've moved to new apartments. And so I have just now put in these new sites. But if I understood you right, you're telling me that starting in March, none of my clients can move to a different apartment to get
No,
services.
we're not saying that. We're saying if they move to a new apartment, we have to assess that apartment. Mm-hmm.
But you said until they go through all of this and get approved. I mean, I'm still waiting here. I mean, I did get into the portal and look back, and it was last June, July, when I did this remediation.
Yes.
And I've never heard anything. Well, I look it up in the new portal, and it says something about remediation required. That is not what I was told. It was heightened scrutiny. You didn't make the deadline, so we have to talk to you. And so we did a Zoom call. And she
Yeah,
told
so
me it would take a month or two, and I've heard nothing.
that's the heightened scrutiny. If you please, everybody attend the call when we send out information. That's the heightened scrutiny, Jane, we were talking about in the heightened
Yes,
scrutiny
yes,
update. So if you are waiting on heightened scrutiny only, Jane, your settings are okay as long as they're in that
I'm
same
okay.
location. You are
Okay,
okay. If you are only waiting
okay,
on heightened scrutiny, you are okay. We have asked for a corrective action plan to give more time for this because, Jane, we cannot make you fully compliant on that setting or settings until CMS gives the final determination. Okay.
yeah, okay. But I'm thinking before it did not say remediation required. And I thought, well, I went in to look. There was no policy procedure, just a picture. I think maybe there was, but anyway, I'm concerned about that. But I'm also concerned about the new settings I have, and I'm also concerned of not understanding how someone can say, "Well, I'm moving to a different apartment," and they move to that apartment, and now I have to go through and at what time do I have to have this compliance done?
As
Are
soon as
they?
possible. Yeah, as soon
It's
as possible
okay.
in order to get paid for
So
that new location.
okay, so I can't get paid. They move and then they don't get services, or I
That's
still have to provide services and I don't get paid.
unfortunately, that's the way CMS is saying if the state of Kansas has not said that setting is compliant with final rule, we cannot use HCBS funding to pay for those services. I know it's just yeah, we're up against the wall almost at this point, and we know we've put it to them, especially with our IDD settings. Individuals, that's their
Yes,
choice. They want to move. It happens,
yes.
but hey, yeah, these they're federal dollars. We have to jump through the hoops for them, and we're figuring out, Jane. Unfortunately, it's
Okay.
been since 2014, getting it figured
Yes,
out and trying our best to stay ahead of it and say, hey, how can we do this? How can we meet compliance and continue those conversations? And maybe eventually things will come out where CMS will pull back and say, okay, some things have
yeah,
came up and
yeah.
we don't want those gaps in services. But as of now, they have their foot down and say, nope, we are not changing these deadlines because we know it will be a continuous. Individuals want to move. They have the choice, the right to move their day services or residential services when they so
But
choose.
by you saying the deadline, but then I'm saying after the deadline, in going forward in the future, when people they want to move to another apartment,
As
how is
soon as
that going to work?
As soon as you know they want to move and you're setting up, helping them get ready, you're getting that new setting. When that setting is located, you're going to be able to reach out and say, hey, we're going into this new setting.
Okay,
We need to get this assessment done ASAP before they move from the current setting or previous setting into that new setting. And, moving takes
okay.
time. Yeah.
And sometimes that happens within a month, and yet some of this has been taking months and months and months and months.
Well,
Yeah,
that's because everything is in house. Everything is in house
Yeah,
now. So that's again,
yeah,
that was learning. There were some
yeah.
contractors involved. Things are at the state level where things can go a little bit more quicker. Things
Yes,
are going a little
yes.
bit more
Okay,
quicker.
we've got a meeting with
okay.
CMS next week, and we're going to talk a little bit more in depth
Yes.
about this ongoing post March 17th deadline, and run through some of these types of scenarios with them, and kind of our ideas for how we envision it, and get their feedback on that. So hopefully the next stakeholder call we'll be able to share some more information about what that's going to look like.
Okay.
Hmm.
Okay. Okay. Sounds
Yeah,
good.
because
Okay.
the concerns are there that after March 17th, not being able to get paid, but service locations are moving daily without a doubt across the state. Somebody's changing their day service
Yes,
location,
I
their
know
residential
in our
service.
little community here, there are some people that they change providers, which of course wouldn't be a big issue if they're going, to day service, or if they're then going into a residential house. But yeah, the clients we have, they're all independent, and they all have their own apartments. And yeah, they moved, and so I'm now trying to get the new ones in. But my concern is what happens in 6 months when they go, we're moving again.
It's like, well, hey, when they figure out that address, everybody, that you're looking at to
Yes.
move into, that's when you get it into the portal ASAP.
Just right. Yes.
Immediately.
Okay.
Yeah. Because like you
Yes.
said, you
Yeah.
usually have to give your notice, especially you private landlords, you got to give that 30-day, 45, sometimes I've seen a 60-day notice. That's where you're going to start the work, unfortunately.
Well,
As of now,
yeah.
get on it,
Yeah.
get that into the
Yeah.
portal, get those requests in and say, hey, we got these new locations over here that we need to get assessed KDADs. Okay.
Yes. I did that one. And then how soon can I expect it to be reviewed and I get information back on it?
My goal, like I said, after we get over this March 17, putting the
No,
HCBS
I'm
compliance.
I just put it in yesterday.
Oh, well,
How
it should be
soon
soon.
can
Yeah,
I
you can
expect
reach out
it?
to me. Yeah, reach out.
Next month,
Yeah.
next week or whatever. It should be shortly that I will hear
Yeah.
back on that.
I say 2 weeks or less. Our goal, 2 weeks or less.
Okay. 10
Putting
days,
final
2 weeks.
final
Okay.
rule team out there. Our goal. I know with the ones I work on is 2 weeks or less. Yeah. Okay. Thank you. I see we got a couple.
Very much.
You're
Thank
welcome.
You.
We got for those that are hanging around, of course, you're welcome to jump off since we're over. But yeah, it's a lot of information. It's a new year. And we want to make sure, yeah, a lot of things are, as Steph said, are still up in the air. We're meeting with CMS next week and then next month to have some more updates for everybody. Because we have a lot of the questions you all still have. Seth knows I'm on him. He's running from me sometime. As little as he's coming with the Seth, what are we gonna do? Who do we need to go talk to? So a lot's going on behind the scenes where we're trying to get clarifications. Chris, you had a question. Are you able to unmute yourself or I can unmute?
Yes, can you hear me?
Yes, I can. Go ahead.
I was asking, when you meet with CMS, what will be your recommendation to them when new settings open, like what was described, a person moves into a new apartment in an independent setting? What will be your recommendation on giving the provider time to complete the assessment? Would that be 30 days, 60? Do you have an idea in mind of what you're going to recommend? Because having it ready and already done, because we might not get a lot of notice that that's going to happen. Sometimes we do, but certainly there are occasions when we don't, and we don't want those service gaps. So could you give us an idea of what you will recommend?
I put it back on the providers like you, Chris. You guys do the work. What would you like us to ask CMS?
Well, I think at least 60 days is because that takes the pressure off of KDADs and having to review it and get information back if there are issues. Now, some of them should go pretty quickly because if the provider has other settings, they can use the same policies and it's just taking the pictures and that sort of thing. But 60 days, I think, is realistic. But
Okay,
having it ready to go on the day they move in, you can start providing services. That's going to probably be a rare occasion.
Thank you. And then when we get information back like that, we can come and say, hey, our network says, hey, this time frame is what they need when an individual moves and relocates that they need to make this happen.
We have a situation currently that we're working with an individual who is going to be moving, but he does not have a new place yet because his guardian is dragging her feet about getting him a new place. And so we're a month out and we don't know where he's going. And so the setting he moves to is not going to be compliant when he moves there. I already know that because we don't even have an address. He hasn't even signed a lease. So to think that we can have that ready to go by March 17th or beyond March 17th as new settings open, to have those ready on the day a person moves in is not realistic.
Thank you for that. And we will take that to CMS next week.
And I appreciate you guys doing that and advocating for us on our side. Thank you so much, Seth and LaTanya.
You're welcome. We appreciate it. Anything else before we wrap up? We're over, but I think we'll make these the hour and a half. It's a lot of information. I know that's why we're like, we got to get these back on because March is here and I know you all have lots of questions and needing clarification on things. So, okay. Thank you. And we're all, some of us are late lunch eaters. Like LaTanya. Okay, I'm not seeing anything. I'm not seeing anybody unmuting. So hopefully you're not trying to unmute. Sometimes it's *6 and sometimes it's the, what is it? What do you call that thing? Hashtag, the number sign, depending on your generation. To unmute, yeah. Depends on what type of phone you have. I have found
The
out.
pound key.
The pound, yeah. Depending on what generation you are, what do you call that? Number button, hashtag, the pound. Okay, everybody, we'll jump off. I don't want to take any more time. Thank you for those that stayed on to hear the information. I'm having to jump off. I'm getting alerts. I do have a 1:30 meeting. So if no last minute things, we appreciate you for jumping on and asking the good questions, sharing information, and we will talk to you next month. Okay.
Thanks all.
Thanks, everybody.